Stitching is frequently used in digital radiography exams where the anatomy won't fit within the 17 by 17 detector. Some exams that you may see the stitching function be used for are the femur, tib-fib, scoliosis series, and leg lengths. The Philips DR equipment that we're going to use can perform stitching when you're doing an exam in the table or using the upright bucky. The video that we're going to show you will demonstrate how to use the stitching function for a tib-fib exam on a Philips DR machine.
Before we get started, we want to pull up our patient and check our accession number on our rec. We want to choose our exam and make sure that it's selected on stitching, or else it will not stitch for us when we take the images. Shannon, I'm going to have you take a seat right on my x-ray table. I've already confirmed my patient's name, date of birth, and if there was any chance of pregnancy. I'm going to steal this from you. Shannon, what leg has been bothering you?
My right leg.
Okay, I'm going to have you lean back. You can lay your head right back. Okay. Now I need to put the tube into both detents. I know that it's ready for stitching because it says number of images 2.
Some systems require that the table be lowered all the way and the tube head be raised all the way up to allow for stitching.
Now I'm going to position my part. I don't want to touch the tube or the bucky since I already lined those up and detented them. I will move my table into the position I need. For the tib fib, we want to include the ankle joint and the knee joint and adjust our light field as necessary. I want to put my right marker in, and for stitching, we use a ruler, and this is how the computer is able to line up the images. It doesn't matter if you include one or the end of the ruler, it'll just read the dots on the ruler to line it up. We should slide it in so that it's not in the anatomy of interest, as close as we can. And now, we are ready for stitching. Shannon, could you flex your toes towards the sky? Great. We've made sure that our part is straight, but we also have to make sure that our ruler is straight as well. Also, we can't angle our collimator box or else the machine will not stitch the image.
All right, I'm gonna take the exposure now. I will have to see that not only one image is taken, but 2 have been taken. And you'll hold it down until the tube is in neutral position. One image. 2 images.
The technical factors used for the particular exposure we made were 65 kVp and 4 mass. AEC is not used for stitching exposures. This is because the tube and the bucky are constantly moving throughout the exposure, so there really isn't a specific cell that can be activated or properly used. Setting automatic technique is very important for stitching. However, most DR systems will have a preset technique that comes up when the exam is selected. That being said, it's important to pay attention to patient body habitus as well as any pathologies that could possibly alter the required technique. In X-ray imaging, angling of the tube causes elongation. Since the tube is angling itself in both directions during a stitching exposure, slight elongation at both ends is to be expected. However, it's minimal. Just like in regular X-ray images, angling of the tube will also cause a slight loss of exposure because the angle creates a greater SID. Digital post-processing is able to compensate for a slight loss of exposure, but it's very important to remember to place thicker anatomy at the cathode end, usually the left side of the table.
So as you can see, the computer automatically stitched the image for us, but we have to make sure that it's stitched properly. So what we do, we go into the stitching editing, we click on that, and we want to take these lines off because if we don't take them off, they will get sent to PACS like that. So what we do for that is we click this right here where there's the orange line. So now that our lines are off, what we want to do is zoom in on the image so that we can see if the anatomy lined up. We're going to check if the ruler lined up, but the most important part is our anatomy matches. So how we zoom is these 3 buttons. This one is less of a zoom, obviously doesn't do much. This one will zoom in a bit more, and then this one zooms in the most. This will give you the most detail. Make sure that when you are going to slide over to find your anatomy that you aren't dragging, because that will drag your anatomy and misalign it. So now that I'm zoomed in, I'm going to slide over so I can look at my anatomy. Here shows a really great image of where my anatomy lines up. It looks like the computer stitched it perfectly for me. However, if my image came out like this, that is when I would need to slide my anatomy around and line it up properly. What I can also use is my ruler. If you made any change to the stitching alignment, when you go out of the stitching app, it will say, do you want to proceed with the stitching of the images? Here's where you'll say yes. What it ends up doing is you have your original image up here, and it saves a new image down at the bottom. So this image up here is the one that I'm going to end up sending to PAX. Now that I've done all of the stitching editing, I can go in and add my annotations, which is the ABC mark. I've added my number. This was my patient's right. Now that I've done all of my annotations, be sure not to press OK due to the complete button being underneath it. Your best option is to press the ABC button, and it'll take you out of your annotation. So these images I do not need, so I'm going to press the reject button, and we are going to click stitching readjustment, press OK. This one as well. Since this is the image that we're going to be sending, we would click it and we would press the green button. However, we're not going to send it. So we're done.